Could your neck be causing your dizziness? In this video, I'm going to show you the best exercises to help get rid of your neck dizziness in the comfort of your home. My name is Dr. Jon Saunders. I've been in clinical practice for over 18 years, helping people with spinal-related health conditions. In my biased opinion, this might be the most complete video on YouTube to help rid your neck dizziness, or what we call cervical vertigo or cervicogenic dizziness, in the comfort of your home. How do you know if the dizziness that you're experiencing is coming from your neck? There are a few clues that you can use to help determine if dizziness might be coming from your neck. The first is the duration. Cervical vertigo or cervicogenic dizziness or neck dizziness can last from a few seconds to a few minutes up to a few hours at a time. Another thing to notice is, do you have neck pain? Do you have stiffness or crepitus or a decreased range of motion that is associated with your dizziness? The dizziness you experience with cervicogenic dizziness is one that would be described as an unsteadiness or a balance problem. You might experience that drunkenness feeling. Head fogginess or fullness can also be described by someone that's suffering from cervical vertigo. As well, some people will experience headaches that almost feel like they're stemming in their neck with their dizziness. Cervicogenic dizziness can be exacerbated by depression, fatigue, anxiety. These are some of the things you want to look out for to determine whether your neck might be causing your dizziness. And here's my disclaimer: cervical vertigo or cervicogenic dizziness is a diagnosis by exclusion. Please see your healthcare provider for any feelings of vertigo or dizziness to make sure you have the appropriate diagnosis. It's very important that we rule out all other potential causes of your dizziness. Okay, let's get to the routine. I'm saying it's a routine because it's not one stretch or one method that's going to help get rid of your dizziness. This needs to be done daily. And so we're going to walk through this together. I want you to follow along with me as usual so you can experience what you should be feeling when we're doing these exercises. The first thing we're going to do, we're going to focus on stretching. We have two important muscles to stretch: our trapezius and our sternocleidomastoid, or our SCM. So we want to start with these stretches, performing each of them for 3 sets with a hold of 30 seconds. So for the first one, what we're going to do, we're going to pull our shoulders back. Posture is king here. We always want to be aware of our posture. And we're very simply going to take our hand on the opposite side of our head, and we're going to slowly pull down and slightly forward. To get a little bit better stretch, you can drop your shoulder down a little bit and lean ahead. You will feel that really through all into the trapezius, even in the scalenes on the side. Really good stretch. We're going to hold this for 30 seconds on both sides. And the same thing, we're going to hold our shoulders back, drive our opposite shoulder down, grab the side of our head, rotate it slightly forward, and just down. And again, you're going to feel that stretch right through here into the trapezius, especially upper trapezius. These are muscles that can get really tight from sitting, so we often need to stretch those to help reduce the tension in those muscles. The next stretch we're going to do is for our SCM, or sternocleidomastoid. All we're going to do for this one is turn our head to the side as far as we can go, and we're going to come back in slight extension. And you might feel a stretch already in this part of the muscle. Some of you will be tight in other areas of the muscle, so what you can do is rotate your head down a bit to change the angle of the stretch. So just rotate up for a bit and then down. Find the point where the most tension is and stay there for 30 seconds. And of course, you want to do this on both sides. Rotate, extend, and then just flex and extend. And just there is a good spot. You can feel that right into my clavicle. And I can come up a little bit. Again, hold this for 30 seconds. If you have any neck issues, be careful with this one because it can irritate some of the joints at the back of the neck. So if you're experiencing any pain, especially in the back, not at the front where the stretch should be felt, but if you're feeling pain in the back, this is one stretch you might want to avoid. Okay, now that our neck is warmed up, we're going to move into some muscle release or myofascial release. in two areas. We're going to focus on our suboccipital area, the area right off the back of our skull. This is a very important area for those that suffer from cervicogenic dizziness because there's a high percentage of mechanoreceptors up there. The other area we're going to focus on is our scalenes. These get really tight and they limit the movement in our neck, which can be associated with decreased range of motion and cervical vertigo. So for both of these movements, we're going to do 3 sets of 5 reps on both sides. The first one is the suboccipital area in the back of the neck. We're going to take our 2 fingers, we're going to drop them just off the back of the skull on the side. Oftentimes it's a tender area in most people, but the first exercise or movement we're going to do, we're going to just put some pressure through those muscles as we go into rotation. There's 1 rep, 2, and you just put enough pressure so you feel it. It might be tender, that's okay. And for some of you, you might only get a certain amount of range of motion. This is okay. These are the range of motions that we want to push into to help restore some of that altered movement. And then again, we're going to do it on both sides. Again, just come off the back, side, right underneath your skull, and you're just going to push a little bit forward as you rotate through. It really feels good. You might feel a bit of a trigger point where it refers pain up or down. Again, that's okay. It's okay to feel a little bit of tenderness. It just shouldn't be too painful. So that was the first muscle release. The second one we're going to work is our scalenes. These are the muscles that run up and down the side of our necks. And for this one, again, we're going to do this in lateral flexion. So lateral flexion is just ear to shoulder. So we don't want to move our whole body. We want to move our ear to our shoulder. And what we want to do is we're going to take 2 or 3 fingers at the top, so just on the side, under the bump behind the ear. And as we come into lateral flexion, we're just going to pull down over the skin and really strip out those muscles. We want to keep things balanced always. And again, remember your shoulders aren't like this. You're not sitting here with poor posture. You know, your neutral posture. Really pay attention to your shoulder blades. You want to pinch them together a bit while you do this myofascial or muscle release. Your neck is going to start to really loosen up after the 2 stretches and then these 2 myofascial release techniques. And now we're going to move on to stabilizing. This is one of my favorite exercises. I prefer to do it sitting, but you can definitely do it standing. You are going to need one of 2 things. One of the easiest things that most people have will be a pillowcase. And you're just going to fold it and just make it narrow so it will fit behind your head. I prefer to use an elastic band, but the pillowcase is just as effective. So this exercise or stabilizer exercise is called the crane cervical flexion exercise. So what we're going to do, we're going to take our pillowcase or our band, we're going to get our elbows at 90 degrees, and we're going to pull forward to pull our head forward. We're going to tuck our chin, and then we're going to retract our neck. And then you're going to let it pull down, tuck, retract. So you almost want to feel like there's a string on top of your head as you're pulling into the resistance of the pillowcase, or in this case, a band. So again, we're going to tuck our chin, activate our deep cervical flexors, pull back, slipped off there. Let's try that again. So again, we're going to tuck our chin, pull back, make that double chin there, and then relax. Tuck, pull, and hold. We're going to hold this for about 5 seconds. Tuck, retract, and hold. 5 seconds. And again, visualize your head pulling up. You are going to feel that in the suboccipital area. So you're going to get a stretch here, but you're also firing your deep cervical flexors, which is very important for any degree of hypermobility or instability in your cervical spine. Let me demonstrate with the pillowcase too, just in case you're using that at home. Let me throw these glasses off here. So again, same thing, 90 degrees with the elbows. This might be a bit easier to do actually, and you're going to tuck and then pull back. You have to give yourself some give in your arms, and then pull forward, tuck, and pull back. I'm making this weird face, I feel like it. It's okay though. hold for 5 seconds, and again. So again, the movement you're doing is you're tucking your chin down while you pull your head back. So you're really kind of doing this movement with your head. So you're trying to pull your head up against a bit of resistance, really isolates those muscles properly, really builds some stability, and it allows your neck to be more stable through its full range of motion. Okay, we're moving along here. I hope you're keeping up. I sometimes move a little fast, as my viewers tell me, but the good news is you can just hit rewind and watch that segment again if you're unsure of anything I've shown you so far. So we have 2 more things to go through to continue your healing process to help with that dizziness that's coming from your neck in the comfort of your home. This next part focuses on strength. So what we want to do is we want to get strong in our muscles, in our ranges of motion. We're going to focus on lateral flexion, which is this movement, rotation, and then protraction and retraction. We're going to do some isometric contractions. So for each of these movements, we want to do 3 sets of 8 to 10 reps with 5-second holds in both directions. So let's work through rotation first. We're going to go all the way as far as we can, and then we're going to place our hand on our forehead, and we're going to continue to push in that direction. So this is obviously left rotation. I'm going to hold for 5 seconds, come back to neutral. Back to the same side, push for 5, and relax. I'll switch to the other side, but you want to do, as I say, 3 sets of anywhere between 5 and 10 reps with those 5-second holds. We'll go to the right rotation, so I can go pretty far on this one. And again, then I'm pushing back. I'm pushing my hand this way and my head opposite to activate the deep muscles. And we're going to hold for 5 seconds. The next one we're going to do is lateral flexion. Again, you might want to look at yourself in the mirror to see, can you go equally on both sides? If you can't, that is a goal that you should have for yourself to try to equalize that range of motion. So right lateral flexion, go to the end, and I'm going to try to push for my hands going this way and my head's going this way, just to demonstrate the contraction. Again, 5 seconds. You can go back and forth if you'd like, so you can go to the opposite side. Try to get to the end range before you do the isometric contraction. And again, hold for 5 seconds, and then come back to neutral. I'll do 1 more set on each side. And come back to neutral again. And then finally, we're going to do protraction and retraction. So protraction, we're going to come out, and all we're going to do with this one, as you come out to full range, you're going to take your palm and you're going to push back on your head, and you're going to fire those muscles. And the same thing for retraction. I find it a little bit better to do it with both hands. So again, try to push your head forward as you retract and hold that for 5 seconds. You could also use the band or the pillowcase you had in the previous exercise to do that as well. So again, forward, which is protraction at the head, push forward. I'm using my fingers here. It doesn't really matter what you use as long as you're getting some activation. And again, back, and again, I'm trying to keep my shoulders back too and pull back. You're probably going to make some awkward faces like me, but that's okay. No one can see you. And again, hold for 5 seconds. Again, 3 sets, 5 to 10 reps, 5-second holds. For each of these things, you're probably gonna have to work up to that. And please understand, if you do have cervicogenic dizziness, that some of these exercises will produce some dizziness. Let me be clear, mild dizziness in the exercises is okay. Moderate to severe dizziness, it's too much. You gotta back off a little bit. You wanna work to a point where these exercises become easier and easier for you. For the final exercise that's necessary to help you help yourself in the comfort of your home alleviate cervicogenic dizziness is oculomotor exercises. Because I have 2 other videos that show these techniques in more detail, I will put them in the description below, and I encourage you to add these to your routine to help with your cervicogenic dizziness. So just to quickly summarize, we've got the 2 stretches, we've got the 2 myofascial or muscle release techniques, we have the crane cervical flexion stretcher exercise. We've got the range of motion with the isometric contractions, and we have the oculomotor exercises. These should be done as a routine. One and done, again, doesn't work. You need to do these daily. And for cervicogenic dizziness, this can be a slug. And what I mean by that, this can take some time for you to notice improvements. At minimum, it's going to take you 3 to 6 months in order to help yourself feel like you're improving. But don't give up. I know it can be frustrating at times. Continue at these exercises to help yourself. If you feel there's something else going on or you're not improving, this is where I encourage you to seek professional help. Someone like a chiropractor. If x-rays are necessary, they can reveal whether you have a cervical spine alignment issue like a loss of cervical curve, a cervical kyphosis, degenerative disc disease, a cervical disc bulge, or even cervical instability. This is something you must know in order to be successful in treating cervicogenic dizziness. I want to thank you for tuning in. If you liked the video, please give it a thumbs up, and I'd really appreciate it if you show some support and subscribe to our channel. If you know someone that's suffering from dizziness, hit the share button. Please share this video with them. And I just want to thank you for leaving all your comments. I try to answer every single one. If you have one, put it below and I'll do my best to get back to you. If you have an idea for a future video, put that there too, and I'll add it to my list of upcoming videos. Thanks again for tuning in, and I can't wait to see you on my next video. Until then, be well.